So most people who get involved with shock trauma orthopedic fracture group, they come here because they flew in a helicopter or came in an ambulance and they had a bad injury. And we're known for taking care of the worst injuries in the country in some ways. But there are a lot of other situations where we get to help people. And so your fractures don't always go well, and those patients often come into us. So there are basically 5 common reasons why people would come in and see us after their fracture care. And these reasons are their fracture didn't heal and it still hurts. Their fracture healed crooked or short and they want to do something about it. They have an infection or maybe a draining wound. They got bad arthritis, that means they have joint problems after it, or their hardware hurts them. And so those 5 reasons make patients after fracture care, no matter where they headed originally, come to see us. And we're very lucky that we have a big team of experts in these areas that are able to take care of patients kind of no matter what their problem is with a fracture. What happens is patients come in to our clinic and we evaluate them carefully in the clinic. We often get laboratory tests and imaging and obviously take a long history to figure out what happened. These situations are often very complicated, sometimes they're not, but these situations are often complicated and we need a long history with the patient to figure out what happens. And then we figure out who is the right doctor to help you, and sometimes that's multiple doctors. We may need our infectious disease experts if it's an infection. We may need our colleagues who put flaps, that's where you move a muscle or skin to cover a hole in your leg. We may need a joint replacement expert that we have after a fracture. And so we'll bring in different parts of our team and work as a team together to get you the best outcome you can. Patients who come to us are having a problem with their fracture. It hasn't healed in the way that they want it to, and they don't have the outcome they want. And our goal is to try to get them as close as we can back to the function they had before their injury.